It turns out that this is sort of an insidious disease, and it comes on people without their being aware of the gravity of the situation. The statin is something that helps to prevent the buildup of cholesterol in the arteries, but it takes a long time for that to happen. And only when it gets to a certain point do you begin to have symptoms. So it's important to be on this medication or some medication to help prevent that if you have a tendency toward it for a long time. And it's not something that helps you feel better, it just helps prevent problems in the future. Obviously, it's not a procedure without risk, and we have to go over those risks with the patient in order for them to understand that we think that it will benefit them, but there are risks associated with it, that they might need a second operation, that they might die. All of those are significant issues. Well, first, there's an artery underneath the breastbone that we take, and we use that for one of the bypasses. One of the advantages of having the artery bypasses is that they tend to last longer than the vein bypasses. When we take vein out of the leg, we generally just make a small incision around the knee and use a scope to take the vein out of the leg. And that can be taken out in the thigh and also down the lower leg, so that people tolerate that really quite well. When we studied that, we saw that the amount of problems related to the incision for taking the vein out was dropped by about 2/3. After the operation, the patients go to an intensive care unit where they're monitored both by the intensive care team and the surgeon. It's a cooperative type of approach, so that we're both looking at what's going on. The favorite part is being able to talk to the patients afterward and help them understand that they have a chance to do really well in the long term. That's the really important part, because that's what's going to help them more actually than the operation. The operation will get them through a period of time, but by understanding their disease and treating it over the long term, that's how they're going to do better. In order to keep those vessels open over the long term, it's important to be on a medication to lower his cholesterol, to lose weight, to avoid becoming diabetic, those sorts of things that can happen to people who gain too much weight, and to remain active. The knowledge of all for the care of one.